Order. I call Secretary of State Matt Hancock to make a statement.
Thank you very much, Madam Deputy Speaker. And with permission, I'd like to make a statement on reforming the Mental Health Act. Even amidst the pandemic, I'm enormously grateful for the work that my team and the NHS have done, led by Sir Simon Wesley and Claire Murdoch and my honourable friend, the Minister for Mental Health, to deliver this white paper, which we published today, to bring mental health legislation into the 21st century. We're committed as a government and as a nation to see mental health treated on a par with physical health. We're increasing funding for mental health services to record levels, with £2.3 billion extra each year being invested through the NHS long-term plan, and an immediate £500 million in place to support mental health services with the very significant pressures they're under today. Our mental health services are now helping more people than ever before, and though services are there for the most serious mental illnesses, although these, of course, are under significant pressure, services are there for better community support through 24/7 crisis services and establishing liaison in A&E, and supporting people to manage their own mental health. Madam Deputy Speaker, this programme of transformation is ambitious, and as we support mental health services now, so we must bring up to date the legislative framework also for the long term. The Mental Health Act was created so people who have severe mental illness and present a risk to themselves or others can be detained and treated for their protection and the protection of those around them. But so much has changed since the Act was put into place nearly 40 years ago. We now understand a lot more about mental health. Public attitudes around mental health have changed significantly for the better, and we now have a better understanding and practice of how we can best support people with learning disabilities and/or autism. We're also concerned by the growing number of people being detained, inequalities among those who are detained, and the length of time that people are spending detained under the Act. So after a generation, we must bring the Mental Health Act into the 21st century. The previous Prime Minister, my right honourable friend, the member for Maidenhead, asked Professor Sir Simon Wesley to lead a review into what a modern Mental Health Act should look like, and I thank her for her work. And I am so grateful to Sir Simon and his vice-chairs for their dedication. As I said to the House last year on its publication, the Wesley Review is one of the finest pieces of work on the treatment of mental health that has been done anywhere in the world. I know that the review was welcomed across the House. We committed in our manifesto to deliver the required changes, and I'm grateful to the Prime Minister for his emphatic support. Sir Simon's review compellingly shows that the Mental Health Act does not work as well as it should for patients or for their loved ones, that the Act goes too far in removing people's autonomy and doesn't give people enough control over their care. So, Madam Deputy Speaker, today I'm delighted to set out our full response to the Wesley Review in our White Paper, which together with my right honourable friend, the Lord Chancellor, we've laid before the House. The White Paper sets out plans for a landmark new Mental Health Act. The new Act will ensure patients are put at the centre of decisions about their own care, that everyone is treated with respect, and the law is only used to compel treatment where absolutely necessary. The White Paper has been developed in close consultation with those with the greatest expertise: the Royal College of Psychiatrists, Rethink Mental Illness, Mind, the Centre for Mental Health, and countless practitioners on the front line, and I thank them all. There are 4 pillars to this work, and I'd like to take a moment to update the House on all of them. First, Madam Deputy Speaker, we will give patients a voice in their own care, which we know leads to better engagement in treatment. So we'll put care and treatment plans and advanced choice documents into statute for the first time, so patients are more closely involved in the development of their care, and so they can have confidence that if they lose capacity because of illness, their preferences will be properly considered. We're making it easier for patients to challenge decisions about their care, creating a new right to choose a nominated person who's best placed to look after their interests. and increasing patients' access to the independent tribunal to provide vital independent scrutiny of detention. In his report, Sir Simon recommended that one of the best ways to ensure dignified care is to ensure that patients can expect the privacy of their own ensuite room. We've already committed £400 million of funding to deliver this, and we're building new mental health hospitals with 2 schemes already approved and with more to come. Second, Madam Deputy Speaker, we'll address the disparities that currently exist within the application of the Mental Health Act. Black people are currently 4 times more likely to be detained under the Mental Health Act than white people. And black people are 10 times more likely to be placed on a community treatment order. We also know that people from black and minority ethnic backgrounds can often engage with services later, and our plans to enhance patient choice, increase scrutiny of decisions, and improve a patient's right to challenge will help us to improve service provision for all. On top of this, we've already announced our new patient and carer race equality framework as recommended by the review. And we're also developing the use of culturally appropriate advocates so patients from all backgrounds can be supported in making their voice heard. Third, Madam Deputy Speaker, it's important that the Act supports patients within the criminal justice system. We'll make sure that where people in prison require treatment in a mental health hospital, they are transferred in a timely way, and we will support rapid diversion from custody to care where appropriate, so people in our criminal justice system can get the right care in the right place at the right time, while we fulfil our fundamental duty to keep the public safe. Finally, Madam Deputy Speaker, in our manifesto, we committed to improve how people with learning disabilities and autistic people are treated under the Act. Until now, the use of powers in the Act did not distinguish between people with mental illness on the one hand and people with learning disabilities and/or autism on the other. This is wrong. Needs are different, and the law should be different too. This is all part of treating everyone with respect. We therefore propose reforms to limit the scope to detain people under the Act where their needs are due to their learning disability or autism alone. In future, there will be a limit of 28 days for these detentions, which would be used to assess clinical need, and wherever possible, we will work to ensure appropriate support is available in the community rather than in institutional settings. I want to thank Baroness Hollins, Ian Birrell, MENCAP and the National Autistic Society for their advocacy and for their support for these reforms. Madam Deputy Speaker, this Act is there for us all, and we want to hear as many views as possible on these plans. So we'll consult widely on this white paper and we'll respond later this year before we bring forward a new mental health bill. I believe that everyone in our society has a contribution to make, and I believe that everyone should be respected for the value that they bring. It is the role of government to support people to reach their potential even at the most difficult of times, and to protect people when they are at their most vulnerable. That is what I believe, and I believe these reforms will help put those values into action and help give patients the dignified treatment that they deserve. I commend this statement and I commend this white paper to the House.
Dr. Rosanna Allen-Carr.
Thank you very much, Madam Deputy Speaker, and I would like to thank the Secretary of State for an advanced copy of the statement. This overhaul of the Mental Health Act has been long awaited, and we welcome this white paper and the fact that the government has accepted the majority of the recommendations from Sir Simon Wesley's independent review of the Mental Health Act. Without a doubt, it is people that need to be at the heart of this legislation. Service users must be involved in framing this legislation going forward. And when we talk of numbers and statistics, we must remember that these are real people with real lives and real families. There is a web of individuals who are affected when things go wrong. Deprivation of liberty and the use of coercion can cause lasting trauma and distress, and this is especially true for children and young people who find themselves in these most difficult of situations and whose voices are often not heard when decisions are being made. And it is an important step that learning disabilities and autism will no longer be grounds for detention under the Act, and I'm sure we all welcome this. It is very welcome that the recommendation on nominated persons has been included. The best way to reduce coercion and detention is to have alternatives to admission. Can the Secretary of State please outline how this will be achieved? Community provision is vital for mental health services that are truly joined up and, crucially, work well for the patient. Will the Secretary of State also be able to give reassurances on community care? It is within our communities where we witness the harsh reality of the health inequalities that so desperately must be addressed. Social inequalities and adverse childhood experience are the drivers of mental ill health, and they cannot be ignored. Children from the poorest 20% of households are 4 times more likely to have serious mental health difficulties by the age of 11, compared with those from the wealthiest 20%. This will not simply be solved by mental health legislative changes. There must be a commitment to addressing the vast chasm of health inequalities across the country. At present, black people are over 4 times more likely to be detained. We need to advance the mental health equality framework, and there must be absolutely culturally appropriate services and the freedom for local areas to look at their specific population in order to have the most suitable approaches. Incredibly crucial to ensuring that mental health services are fit for purpose are mental health staffing levels. The proposals set out by the Secretary of State go well beyond what has been committed in the long-term plan, and we need to see true understanding from government that mental health isn't about promising fancy equipment, it's about people. The promises in this white paper rely on a workforce, our fantastic frontline mental health staff, of which there are simply too few at present. Can the Secretary of State please outline when we will get the workforce settlement and what reassurance he can give on filling training places? It has already taken so long to get to this point. It was the former Prime Minister who started this process back in 2016. So could the Secretary of State provide some clarity on the timeframe going forward? Given the complexities of the legislation and the need for it to be robust, what are the plans for a joint pre-legislation committee? It is vital that the blueprint Sir Simon Wesley's report set out is implemented in full. I would like to take this opportunity to thank him and everyone involved for all the work they have done on this review. We must act, and act quickly. COVID has shown us how all the pressures on mental health are building, and we need action now. We all know how rare these pieces of legislation are. This is a once-in-a-generation opportunity to get it right for some of the most vulnerable in our society. We must simply get this right for everyone who depends on these services. Thank you.
Secretary of State.
Well, thank you very much, Madam Deputy Speaker. And can I thank the Shadow Minister for her thoughtful approach. And I agree with the way that she has described the challenge and also with her insistence that we must not just improve the legislation, and we will, but we must also improve and continue to strengthen service provision, and in particular community service provision as an alternative to admission, because that is how we turn legislation from dry words on a page into real action on the ground. She's absolutely right too to say that service users must be at the heart of framing the legislation. And if I link that point to the question she asked about time frame at the end, the challenge of the time frame is to make sure that we move fast enough to help people and get the new legislation onto the statute book as quickly as reasonably possible, but at the same time continue with the consensus-based approach which we've taken. I'm very grateful to the work, as I said, of Sir Simon and the NHS team, and also because we have managed to develop this white paper with the broad consensus of those who provide mental health services and service users and politically across this House. And I think that that is an important consensus to keep. And I want to try to keep it by ensuring that we take as open an approach as possible to the legislation. I'm absolutely open to joint pre-legislative scrutiny. I'm absolutely open to the publication of a draft bill. Let's get the details right. Let's work together on this and keep it as consensual as possible. I also agree with her point about the need to tackle broader health inequalities, and that COVID has laid some of these bare. And this is a core part of our levelling up agenda, and it's an important consideration both in terms of physical and mental health. So I'm glad to say, Madam Deputy Speaker, that this landmark white paper that will lead to a once-in-a-generation bill, I'm glad to say that is proceeding with the support of the opposition. I'm really pleased about that, because this is for everyone, and it is to make sure that some of the most vulnerable people in our country get the support that they need and deserve.
Theresa May.
Thank you, Madam Deputy Speaker. And may I congratulate my right honourable friend on this white paper, but also congratulate him for his continued commitment to this issue during what have been really challenging times for himself and his department in dealing with the pandemic. I fear that the legislation, though, may not be on the statute book until 2023. Meanwhile, GPs and hospitals dealing with my constituents, caring for my constituents, tell me there is an increasing problem of mental health and increasing numbers of people with mental health problems, particularly young people. So what steps can my right honourable friend take to put in place the principles that underpinned the Wesley Review? And I thank Sir Simon Wesley once again and his team for their work. Those principles of less coercion, better choice and control for service users, better care, and a reduction in inequality and discrimination. Put those principles into place while dealing with the growing number of people who have mental health problems, some as a result of the pandemic.
Thank you very much, Madam Deputy Speaker. Well, can I put on the record my gratitude to my right honourable friend? Without her, I'm not sure we would have reached this point, and her dedication to this topic, both as Home Secretary and then as Prime Minister, and since, has been vital. And I'm grateful for the advice that she's given me in the last few months as we've prepared this white paper. I'm grateful to her for appointing Sir Simon Wesley, and I'm grateful to her for appointing me as Health Secretary too. She's absolutely right about the urgent pressures that are there right now in mental health services right across the country. So I'm really pleased we were able to keep this work going during the pandemic on the policy side and the new legislation that we are proposing. But at the same time, in hospitals and in GP surgeries right across this country, there is urgent pressure on mental health services. We know that there are mental health impacts of the actions that we have to take to control COVID. As I said in my statement, we've put in more money in the short term on top of the long-term plan that was agreed when my right honourable friend was Prime Minister. And we're committed to doing everything we can to support people with mental ill health and, crucially, to support people to keep their mental health strong, even if they don't have a mental illness, because these are difficult times. And the good public health approach, in the same way that you keep your physical, you look out for your physical health, looking out for your mental health is an important thing for all of us. So too is the provision of acute services for people with serious mental health conditions, which is under strain right now. We're willing and have put the money in at the spending review, but we've also got to give support for the clinicians working on the front line and working so hard right now.
We now go to the SNP spokesman, Dr. Lisa Campbell.
Many thanks, Madam Deputy Speaker. This describes a long overdue reform of the Mental Health Act that rightly seeks to ensure parity of mental health, improve access to advocacy and individualised decision making, treatment within the least restrictive environment, and which also attempts to address the systematic inequalities we've heard about that have existed for those with autism and learning disability, where too often their rights have been quashed within the system, and it is absolutely correct that this is addressed. The Scottish Government recognises the importance of individual rights within treatment and are currently reviewing the mental health and incapacity legislation in Scotland within the mental health strategy, following on from the Learning Disability and Autism Review. But as chair of the Psychology All-Party Parliamentary Group, I hear about difficulties in the current mental health system across the UK from patients themselves, including for those who self-harm but may not meet a diagnosis of any disorder. There exists a cycle of assessment and discharge for patients, so will the progress announced meet their treatment needs? There's also an issue of accessibility to services for those with comorbid mental health and addiction issues, including access to rehabilitation units. So how will comorbidity be addressed within the reforms? And those with autism are currently overrepresented, as we know, in our criminal justice systems. So will diversion services make sure that this great disparity in access to care in the crisis for most vulnerable people with autism is finally addressed?
Thank you very much, Madam Deputy Speaker. Well, I welcome the comments of the SNP spokesman, and I appreciate the support and the thoughtful questions. She's quite right about ensuring that we address the challenges that present themselves by people with autism who are, as she says, disproportionately likely to end up in the criminal justice system. This is an issue on which I work very closely with my right honourable friend, the Lord Chancellor. I'm delighted that he's been able to join us for this discussion, because that part of the point of separating the attitude in law towards those with mental ill health and those with learning disabilities and autism also relates to treatment when there is also an interaction with the criminal justice system. It's absolutely critical to get this right. It's difficult, and there are a huge number of people working very hard to get this right on the front line. But at the moment, they are hampered by the law in the way that that can happen. And I hope that in future, they will be supported by the law in the way that they can make sure people get the right support and the right treatment, whether they're in the criminal justice system or, of course, for the vast majority of people who are law-abiding and need support from the state because of being in a very vulnerable condition.
Now we'll go to the chairman of the Select Committee, Jeremy Hunt.
Thank you, Madam Deputy Speaker. And can I thank my right honourable friend for a comprehensive response to Sir Simon Wesley's superb review, which I was proud to commission at the request of the former Prime Minister, the right honourable member for Maidenhead, whose commitment to mental health issues has been unparalleled. But he knows that changes in the law only matter insofar as they affect the lives of real people. And his department's own data says we still have over 2,000 people with autism and learning disabilities locked up in mental health units, often supposedly temporary, sadly sometimes with terrible breaches of human rights, such as the frequent use of restraint. So will he use this landmark moment to follow what Italy have done and close down all such units so that these highly vulnerable people can be looked after more humanely in the community?
Well, absolutely, I want to see more people cared for in appropriate settings, and that often is in the community. He set the target as Health Secretary to reduce the number of people with autism and or learning disabilities who are in secure inpatient care. The 2,000 figure that he quotes is a significant reduction, I'm glad to say, on when he set that target and set that work in train. It's almost half, and I want to see that number continue to fall. Of course, where there is a criminal justice element or restriction, that can be more difficult. But what we must do is make sure that the treatment and the setting is appropriate for each and every person. And very often a mental health setting is not appropriate for somebody with learning disabilities or somebody with autism, for whom it can be, in fact, the opposite of appropriate. It could be much the worst place. He will know, as chair of the Select Committee, that the CQC has in fact closed a number of settings during the pandemic, and we must make sure that we build more capacity, and we have the budget in the spending review to do that, and some of that building work is underway. So there's a huge programme of work on the physical estate side, also on training of staff, as the Honourable Lady on the opposition front bench mentioned, as well and as a part of this legislative change. And no one element of that transformation works without all of the others.
Munira Wilson.
Thank you very much, Madam Deputy Speaker. And could I start by welcoming the Secretary of State's statement and the publication of this long overdue white paper. As has already been alluded to, the increased level of safeguards and a commitment to improving the quality of inpatient care will also require a significant recruitment drive for mental health services. Recent forecasts suggest, for instance, that only 71 additional consultant psychiatrists will be added to the NHS workforce by 2023-24, against a requirement of over 1,000 to deliver the long-term plan. So what measures will the Secretary of State be taking to address the additional workforce requirements from reforming the Mental Health Act?
It's a very important question. I don't recognise that 71 figure. I will look into it, and I will write to her with my full understanding of the situation, having consulted with Health Education England. But the short answer to her question is that we are hiring both psychiatrists and also mental health nurses who play such a critical role.
James Sunderland.
Madam Deputy Speaker, mental health is so important, not least for our veterans. So can I please commend the Minister for his really hard work at this time and this excellent initiative at what is a really, really busy time for the country. There is, however, one area in the statement which is not covered, namely child and adolescent mental health services. Could I please ask for his reassurance today that he'll also look at this as a matter of urgency? Families are waiting a long time for appointments at CAMHS. They're living in desperate times, so could I please ask for his reassurance on that issue?
Yes, absolutely. If I can give this reassurance that for those who need to access IAPs and talking therapies for the lower level mental health conditions, the waiting times for those has come down quite considerably, and on the latest data I saw was 15 days, which is a considerable improvement. But the services for more serious mental health conditions are under pressure at the moment, and putting more resources into those is going to be critical.
Jim Shannon.
Speaker, can I thank the Secretary of State for the statement today, and also for the very clear way that the Secretary of State has put forward to help those who are vulnerable and have problems, as it's very, very important. Could I ask the Secretary of State, please, some clarity on what support has been given to the first line of mental health diagnosis in the form of GP practices, which refer patients on only to see them worsen in the months ahead? It takes for them to be formally assessed and get the help they need, which is leading to a high rate of strong medicine instead of counselling. I believe that's very important. Thank you.
Well, he's absolutely right that GPs are the absolute front line in treating mental ill health, not least because the first presentation of mental illness is often amongst GPs. Funding for these services is increasing, and it's very important that that continues. But also, as GPs form into larger groups, for instance through primary care networks, the ability to have more specialist help is strengthened as well. And I want to see a closer integration between primary care, mental health trusts and acute trusts within the NHS. Throughout its history, the NHS has held mental health trusts separately from the provision of other services. And it's increasingly clear that their integration rather than separation is the way forward.
Sir Robert Neal.
Thank you, Madam Deputy Speaker. May I warmly congratulate my right honourable friend upon the statement, and my right honourable friend, the Lord Chancellor, who I'm delighted to see on the Treasury bench with him. The abolition of the appalling practice of using prison as a place of safety for those who are mentally unwell is particularly welcome. That was unfair upon the individuals and also unfair upon the prison staff who had to deal with them under often unsatisfactory conditions. Frequently it happened because at the end of a hearing, magistrates or judges had endeavoured to search around and find a hospital place, but none was available at the end of the day. Can my right honourable friend tell us what practical steps and resources will be put in place to ensure that a hospital place is identified before the defendant appears in court so that they can then be taken swiftly and seamlessly to an appropriate safe place rather than prison?
Well, ensuring that that sort of link-up is standard practice across the criminal justice system is critical, and it's one of the areas that the Lord Chancellor and I are working on. But ultimately, so too is the provision of enough places, because you can only send somebody to a place if the place exists, and that consists of two pieces of work. The first is building more mental health hospitals, but the second is ensuring that people leave mental health hospitals when they can be better cared for in the community. Often it is both cheaper and better for a patient to be treated in the community, but provision of the community services needs to be in place so that discharge can take place, and there's a significant amount of work going on to try to improve that process.
Kevin Jones.
Thank you, Madam Deputy Speaker, and can I thank the Secretary of State for his statement and welcome the publication of the White Paper today. It is important in these reforms that the patient has got to be at the centre of their treatment. The provision in the review of mental health advocates for mental health patients is very welcome. But can I suggest that it works very closely with the community and voluntary sector and possibly look at funding for those sectors in terms of being able to provide the advocates that which will need if these reforms take place and go forward?
I'm very happy to do that. Madam Deputy Speaker, one of the most striking and out-of-date things about the current legislation is that for somebody who is unmarried, if they are incapacitated through illness, then decisions on their behalf are automatically, in the first instance, taken by their father, rather than them choosing who might take those decisions. That's one of the things that we want to change, along with the wider point about the support for the community and voluntary services that the honourable member rightly suggests.
Jackie Doyle-Price. Deputy Speaker. I would like to add my voice to those tributes paid to Simon Wesley. My right honourable friend will know that he drew extensively from the lived experience of those who've been through detention under the Mental Health Act. Would he join me in paying tribute to those individuals who often had to relive very harrowing and distressing experiences so that we might improve our services through this Act, recognising that their contribution will pay dividends to those who follow their treatment in future?
I would like very much to pay tribute to those who bravely put forward their testimony of their lived experience of what it was like to be a service user under the existing Act, which formed so much of the evidence of what we need to do to make it better. But I'd also, Madam Deputy Speaker, like to pay tribute to the Honourable Lady, to my honourable friend, because she was the Minister for Mental Health during much of the framing both of the review and the initial turning of the review into this white paper. And she did that with such sensitivity, thought, and crucially, actively really listening to what people want when they are at some of the most vulnerable points in their lives. It is not easy to do that. It requires skill and compassion, and my honourable friend has both in spades.
Kim Johnson.
Thank you, Madam Deputy Speaker. Welcome the changes being proposed today, because as the Mental Health Act currently stands, Black people are 4 times more likely to be detained and more than 10 times more likely to be subject to a community treatment order. And evidence from my own constituency of Liverpool Riverside echoes this, with my office dealing with multiple requests for support from constituents from our very diverse communities. So can the Minister confirm the steps being proposed will ensure care is accessible, culturally appropriate and free from the levels of discrimination, currently experienced? Thank you.
Yes, Madam Deputy Speaker, the Honourable Lady is absolutely right to draw this point out, and the figures that she quotes were one of the reasons that it just became so urgently clear that we need to make these changes. Now, we need to make these changes as fast as is reasonably possible, but no faster. We need to bring people with us. We need to give people time to read and consider the white paper, and also to look at the legislation as it's being drafted and as it makes its way through the House. But the figures she sets out just demonstrates why it's so important that we make these changes, and I'm just really delighted that the Prime Minister has set aside the future parliamentary time to be able to make this new Mental Health Act a reality.
Henry Smith.
Thank you, Madam Deputy Speaker. I very much welcome this statement and support the work that this government has done in improving mental health provision through our schools. Children and young people are a critical part of getting mental health right, and therefore, as we reform the Mental Health Act, can I have an assurance that educational settings will very much be at the heart of that?
Yes, absolutely. We've put more support directly in to schools, and are rolling out the mental health link workers to make sure young people get the support when they need it.
Steve McCabe.
Thank you, Madam Deputy Speaker. Can I welcome the approach the Secretary of State is adopting on this issue? Can he give an assurance that independent mental health advocates will have the power to challenge treatment decisions and make applications for discharge?
Well, that is one of the purposes of having advocates in this way. Exactly how we frame that in law will no doubt be a subject for nuance and debate to get right. And I'm very grateful for the Honourable Gentleman's support. It is very heartening to see the emphatic cross-party support there is for this white paper today. And the commitment I'll give to him is that we should continue to discuss, and we will continue to discuss, in an open-minded way, exactly how we put the details into legislation to make sure that we get them right and we continue with this consensus-based approach.
Lee Anderson.
Thank you, Madam Deputy Speaker. In December 2016, with just a few months to live, my wife received the gift of a double lung transplant, courtesy of her donor, a young lady called Holly. My wife coped with the physical recovery very well, thanks to our brilliant NHS and a loving family. However, her mental recovery is ongoing. My wife fell into a depression, believing that her lungs would reject and she would die. With our new opt-out organ donor scheme, thousands more will receive the gift of life. Could my right honourable friend please advise me on what more can be done to ensure that the mental health of donor recipients is treated on an equal footing to their physical health?
Well, Madam Deputy Speaker, it's very moving to hear the personal testimony of so many people, and I'm grateful to my honourable friend for his personal testimony today of how important this is. I like him on the subject that he raises, Madam Deputy Speaker. I'm thrilled that we've been able to make organ donation opt out, and we did that in the middle of the pandemic as well. But he's quite right that it isn't just about physical recovery, it's about physical and mental recovery. And the point that he makes so sensitively, Madam Deputy Speaker, just shows how important and how broad this subject is. And I'd be very happy to work with him on this specific subject to make sure that people get the best possible services that they can.
Barbara Keeley.
Thank you, Madam Deputy Speaker. On the issue of the detention of the 2,000 autistic people and people with learning disabilities who are currently trapped in inappropriate mental health units, the news that autism and learning disabilities will no longer be grounds for detention under the Mental Health Act is welcome. But as well as changes to the legal framework, ending this inpatient detention means putting in place funding for community support, which has often not been available due to cuts to council budgets. Can the Secretary of State set out what additional funding the government will be putting into those community services so that we can follow through on this much needed reform?
Well, we have put extra funding into those services. I absolutely appreciate that, especially with the pandemic, they are under pressure, of course. But she's right that you've got to have the community services in place, and whether those are NHS community services or community services provided by council, it's very important that that is provided in as seamless way as possible. In fact, the best commissioned is often joint commissioned between local authorities and the NHS, and I hope that a wider set of reforms to the provision of local health services that have initially been set out by the NHS but which we will be taking forward will help us in combined with this legislation to ensure that link up that she rightly addresses is much stronger.
Roman Chichti.
Thank you, Madam Deputy Speaker. Firstly, can I thank the Secretary of State for the statement and Sir Simon Wesley for the fantastic work he and the team have done on the review. And personally, a big thank you to Sir Simon Wesley, who helped me with 2 previous private members' bills on improving mental health care. Can I ask the Secretary of State this specific question? Will there be proposals to have a review timeline in these measures? Say, for example, 2 years. As we often know in Parliament, sometimes when we put forward legislation and how it works in practice are 2 separate things. And linked to that, can the Secretary of State clarify, with regards to parity of esteem between physical health and mental health, what proportion of NHS frontline staff dealing with individuals suffering with mental health have had the COVID-19 vaccination, as well as patients suffering from mental health themselves?
Thank you very much. I haven't got the exact figure on that last question, not least because it goes up every day, I'm glad to say. But the answer of the total number of NHS staff who've had the vaccination is now in the hundreds of thousands. I'm also very grateful for the broader point that he made. And if I may say this, Madam Deputy Speaker, there are NHS staff themselves on the front line who have supported people through very traumatic experiences over these past few months, over 2020 and the first peak, and then even more intensively in some cases over the past few weeks. And it's even harder this time round because it's happened after a whole year of dealing with this pandemic. And making sure that we support the mental health of those working on the front line, in emergency departments, in intensive care units, is incredibly important. We've put extra resources into making sure that people get those services. Often with the NHS, it's about encouraging people to come forward to access those services. Sir Simon Wesley, of course, first came to prominence working with the Army on supporting them in dealing with PTSD. And we've got to make sure that we put all the possible support in to make sure frontline NHS staff who've suffered trauma because of what they've seen and what they've had to do in looking after us all in this COVID pandemic, we've got to make sure they're looked after, and I make a personal commitment today to making sure we do all we can to look after them.
Tamanjeet Singh Desai.
Thank you very much. Madam Deputy Speaker, 1 in 8 LGBT plus young people aged 18 to 24 have said that sadly they were tempted to take their own life within the last year. So can the Secretary of State highlight how does the government intend to address this shocking statistic and ensure that every young person within the LGBT plus community has access to mental health crisis support?
Madam Deputy Speaker, one of the things that we've tried to do, and it's been made more important because of the pandemic, is ensure that access to IAPT therapies is available and to make sure that mental health support is as widely available as possible. And we've managed to bring some of those waiting times down, even whilst the pandemic is on, although it is more difficult in lockdown. So this is an area of a huge amount of focus for us, and in particular for the Minister for Suicide Prevention. It's a very important subject on which we're working very hard.
And finally, Dean Russell.
don't.
My right honourable friend, the Lord Chancellor, on this landmark
Order.
announcement.
Order. I will ask the link wasn't quite perfect. I'll ask the honourable gentleman to start again. Dean Russell.
Thank you, Madam Deputy Speaker, again. I would like to thank my right honourable friend and the Lord Chancellor on this landmark announcement today. As a member of both the Joint Committee for Human Rights and the Health and Social Care Select Committee, we have covered the serious impact of the current Mental Health Act in detail, particularly on people with learning disabilities and autism, and especially over the past year. So could my right honourable friend please set out what steps he is taking to change the way people with learning disabilities and autism are treated within law?
Well, this piece of work that my honourable friend has done so much on, alongside other members of the Select Committee and more broadly, this piece of work to ensure that the law treats people with learning disabilities and autism separately from how it treats people with mental ill health, and as appropriately as possible for both. This has been the big development on top of the Wesley report that is in this white paper. And it builds on the learnings that we've had over the last couple of years, where the focus on this subject has become yet more acute, and rightly so. The need to ensure people get the appropriate provision in the community, if at all possible, and critically, the need to make sure that the legislative underpinnings supports that and does not wrongly attribute and use mental health legislation when that isn't the appropriate legislation. I'm really glad that we've been able to build that on top of the Wesley report. I'm really glad that's had such a warm welcome. Now we've got to get the details right, and I look forward to working with him, who's done so much work on it, and others, to make sure that the details of how this is framed exactly in legislation is got right.
Thank you. I will take the honourable gentleman's point of order after I've taken the next application, because that is the correct order of procedure. Mr. Speaker has received, I will allow the Secretary of State and the Lord Chancellor to leave the chamber. Mr. Speaker has received an application under Standing Order 24, and I now call the Honourable Member for North Antrim to make an application for leave to propose a debate on a specific and important matter that should have urgent consideration under the terms of Standing Order number 24. The Honourable Member has 3 minutes in which to make his application. Mr. Ian Paisley.
Thank you, Madam Deputy Speaker. I seek leave to propose that the House should debate a specific and important matter that should have urgent consideration, namely discarded human organs, and I welcome the fact that the Health Minister is in her place to hear this SO24. And Madam Deputy Speaker, live and deceased donor kidney transplants in Northern Ireland were paused in October of last year due to COVID pressures, and I understand it is a similar picture across most of the 23 transplant units in GB. Yesterday, however, I learnt that a number of donor kidneys have been discarded. I was horrified. How can this House persuade the health authorities to recommence kidney donor transplant operations, to utilise public and private and unused operating theatre space, and stop a scandal of discarding viable transplant organs from developing? Discarding viable organs has a disheartening impact on donors, let alone on patients. Discarding takes away from the exceptional work of our medical staff. Last year, Northern Ireland Kidney Transplant operating in the Belfast Trust were able to utilise trust theatres and indeed private hospital theatres at night and carried out a record number of kidney transplants. This remarkable, life-changing, life-enhancing work should be and could be allowed to continue. COVID, as we know, can attack vital organs. Those with kidney failure are vulnerable to harsher health outcomes if they get COVID. A transplant now, according to data I have been made aware of, gives better recovery outcomes. I have been told that in all likelihood that post-COVID, more people in the UK could require kidney transplants. So to be discarding usable donor kidneys is a shocking waste and a potential scandal. An unintended consequence is that a pause in transplant operations now could lead to a shortage of viable organs in the future. We have a duty to future-proof demand by ensuring kidney transplants continue now. Currently, if a viable donor kidney is offered to Belfast, it is routinely refused. It is then offered to one of the other 23 units in Great Britain. If not used there, it is discarded. Madam Deputy Speaker, the Health Secretary needs to spell out the precise numbers of discarded kidney, heart, pancreas, liver and lungs across each of the regions of the United Kingdom. He needs to spell out the percentage increase in discarded organs since 2019. I know that since October 2020, 24 patients have been denied a kidney transplant in Northern Ireland. It can only be assumed that the number of denied operations is far greater across the whole of the United Kingdom. Can the Government confirm that number urgently? Will the Belfast Trust and other management bodies in Great Britain now grant the opening of kidney transplant operations? Will they consider using the South West Trust? Will they agree to use private theatre facilities if required to expedite need? Can I salute the expert and wonderful work that we have in this field, untie the hands of these experts and let them get on with this life-saving work? Madam Deputy Speaker, let's halt this scandal. I so seek leave of the House.
The honourable member asks leave to propose a debate on the specific and important matter of discarded human organs, which he has brought urgently to the House. I have to say to the honourable gentleman that Mr. Speaker is not satisfied that the matter raised is proper to be discussed under Standing Order number 24, and therefore he will not ask for time for a debate. But that does not mean that Mr. Speaker has not taken this matter seriously, and I'm very pleased to see that the Minister is on the bench and has listened to every word of the honourable gentleman's application. I'm quite sure that she is indicating to me her assent, that she will carefully consider ways in which the matter can be taken forward, both in this House and in policy terms. I thank the honourable gentleman for bringing this urgent and very disturbing matter to the attention of the House and of the Government. Point of order, Sir Charles Walker.
Point of order, Madam Deputy Speaker. Sorry. Dear, I'm falling to pieces up here, Madam Deputy Speaker. Madam Deputy Speaker, can you advise me how best I can use a point of order to thank Sir Simon Wesley for all his work in producing Reforming the Mental Health Act white paper? Of course, I wasn't able to get on the order paper, Madam Deputy Speaker, but there are many other people to thank. My right honourable friend from Maidenhead, the Secretary of State, and particularly Matilda McCattram, former Director of Black Mental Health UK, who did so much to raise the concerns of the Black and African Caribbean community in and around the use of community treatment orders. Is it legitimate to use a point of order, Madam Deputy Speaker, to raise this, or have I actually abused the point of order process in doing so?
The honourable gentleman knows the answer to his question. It is not at all legitimate to use an apparent point of order, a suggested point of order, to make the point that he wishes to make. But although it is certainly not a matter for the chair, I acknowledge that he is making the remarks he has just made in good faith, that he wishes to thank the people that he has mentioned. Those people were thanked during the statement by the Secretary of State for Health, and I'm sure that the whole House agrees with the honourable gentleman in his non-point of order. I'm now suspending the House very briefly for 2 minutes in order to make the necessary arrangements for the next business. Order.